So these are some diagnostic uh, considerations to make when looking at diagnosing mental illness. This is all in the um, textbook you have on DSM and Lanahan's, but just some things to consider. First of all, the diagnostic manual is not perfect by any means. It has inconsistencies, it misses cultural features, um, it accounts for only part of a person's mental and psychological existence. So with that in mind, these are some things just to keep in mind. So one of them is called the Global Assessment of Functioning. Back in DSM-3 and 3R and 4, these were considered important measures. Basically, they give the person diagnosing the person, the client or patient, some level of, in a sense, where they're functioning at. So I worked at the mental health clinic years ago, and when we used the GAF, which by the way is different for adults and children, I'll get to that in just a minute, we would have a cutoff of 55 as whether or not we would see the person for mental health treatment. Obviously, a person with a GAF of 90 is doing pretty well. They may have some symptoms, but for our clinic to see them, they needed to be much, much lower. These things change over time. Generally, what we did was we would have a GAF score when they came in. By the way, this was always done on axis 5 of DSM-3 and 4. And the GAF then, we would use that as a thumbnail evaluation of whether or not they're changing. So 3 months and 6 months and 9 months later, we would reassess their GAF. Hopefully, the treatment would be helping them. Incidentally, on DSM 3 and 4, there were 5 scales. The first scale, axis 1, was the clinical scale where mental health disorders were diagnosed, like depression and mania and schizophrenia. Scale 2 included, or axis 2 included, personality disorders and what we call mental intellectual disabilities. Today it was called then mental retardation. Those were modifiers of axis 1. Axis 3, which we're going to talk about in just a minute, included physical disabilities that might, in fact, or medical health problems that would affect axis 1. Axis 4 was the level of stressors in a person's life. Incidentally, this was extremely subjective. So what would be a stressor for one person may not be for somebody else. But basically, you would list the stressors, maybe unemployment or divorce or those sorts of things, or death in the family, and it would go from mild to catastrophic. And then, of course, axis 5 was the global assessment of functioning. Obviously, the higher the score, the better. In children, there's a child global assessment of functioning that focuses more on disruptive childhood behaviors. In DSM-5, all of that was eliminated. There's one axis, and everything on that axis includes all axes 1 through 5. The things that are at the start of axis 5 or axis 1 on DSM-5 are the most important ones. So if you had 3 diagnoses, they would be listed in order of importance, including intellectual disabilities or personality disorders, including health problems. So if you had cancer, that might be listed on the first axis. And little attention is paid to either stressors or global assessment of functioning. Apparently, the American Psychiatric Association didn't think that was that important. So what are some of the physical disorders? These are all listed in the back of the book if this is difficult to read, that affect mental diagnoses. They include cardiovascular problems, including such things as congestive heart failure, heart attacks. There's one in particular on there, mitral valve prolapse, that may not be of any particular interest to you, but the symptoms of it imitate anxiety attacks. So it's not uncommon for someone to go into an emergency room thinking that they're having a heart attack, and in fact, it's caused by a mitral valve prolapse. Endocrine problems include all of the internal organs, and they include some really fascinating physical disorders that mimic mental health problems. One I neglected to tell you about was up on cardiovascular. I don't know why that's up there. It includes hyperthyroidism, which is actually an endocrine gland. And it's also listed below. Addison's disease, which is an adrenal gland problem. Cushing's disease, if you remember Barbara Bush and actually John F. Kennedy both had Cushing's disease, which is a problem with the adrenal glands. Diabetes, of course, which is one of the most ubiquitous physical disorders that affects mental health dramatically. Hyperparathyroidism. Parathyroids, remember, regulate calcium and potassium levels in the body. Hyper and hypothyroidism. Klinefelter's disease, which is a genetic disorder where the person has an imbalance in the sex hormone or sex genes. And of course, Turner syndrome as well. Even PMS, which is at the bottom of the sheet, is an interesting one. And we can talk about these in the Zoom meetings if you like. Is found its way all the way into the consciousness of psychologists as a mental illness now. It's called late luteal phase disorder. It also includes neurological disorders. Many of these are listed in the DSM-5 as neurocognitive disorders. They include Alzheimer's disease with frontotemporal disorder. Essentially, it's a disorder of memory. Amyotrophic lateral sclerosis, which you may not have heard of in those terms, but it's also known as Lou Gehrig's disease. Brain tumors, cerebellar degeneration, which leads to problems with balance and mobility. Cerebrovascular accident, which is another fancy term for a stroke. Crutchfield-Jakob disease, which is caused by a parasite, prions that come from certain contaminated meats. Encephalitis, epilepsy, which is a very common neurological disorder that's actually diagnosed in the DSM-5. Extradural hematoma, that would be a bleed in the dura of the brain. Head traumas, which are very common with all kinds of mental health problems. Just think about all the football players that have had multiple concussions. Huntington's chorea, which is another genetic neurological disorder that eventually in anyone that gets it, it's passed along in the genes and they end up dying from it. Intracerebral hematoma, that would be a bleed in the brain. Meningitis, which of course is a common infection in the brain. It's not uncommon to see on college campuses in the fall semester. Migraines, multiple sclerosis, which is an interesting and even more treatable disorder nowadays with medications. Multi-infarcts would be having strokes, but very small strokes that cause transient symptoms. Neuroencephalitis, which is an infection in the brain. Normal pressure hydrocephalus, which you don't really see too often anymore. So the person has a swollen head. It happens in infancy and generally is treated very early in life with a shunt that rediverts the cerebrospinal fluid away from building up in the brain. Parkinson's disease, which I happen to know something about since I have it. It can range from mild cases like I have with a hand tremor to severe ones that cause psychosis. And, 100 people with it are all different. I'm just lucky enough to have a super mild case of it. Um, progressive supranuclear palsy, which is a fairly unusual um, neurological disorder that causes motor impairment. And I can't really see the rest of them. So anyway, so sometimes you have to diagnose the neurological disorder to come up with or if it's available, to rule out mental health problems. Other ones include pulmonary disorders, which include the lungs. One of the most common ones, of course, is asthma. Asthma can restrict a person's ability to, especially children, their ability to function in normal day-to-day operations or activities. Chronic obstructive pulmonary disease or lung disease, COPD, and that can be caused, one of the major causes is smoking. Hyperventilation, which causes changes in the pH of the blood, which mimic heart attacks and anxiety attacks. And of course, pulmonary hypertension or pulmonary emboli, that are clots that form in the lungs and cause all kinds of havoc and actually lead to death. Other ones include collagen, problems with the collagen, fibromyalgia, pelvic disease, Tourette's syndrome, and of course vitamin deficiency, including B vitamin deficiencies, folic acid, which is particularly a problem when a person is pregnant, niacin deficiencies, and of course other B vitamin deficiencies like thiamine. So often what a psychiatrist will do is try to rule out whether or not there's a neurological vitamin pulmonary cardiovascular disease that's causing the problem instead of something that's more psychiatric. Sometimes these are not so easy to actually rule out. And then, of course, there's different classes of medications. They include analgesics, which deal with pain, anesthetics, which deal with changing. There's like super analgesics that cause a state of unconsciousness. They include propofol and other ones that, like Michael Jackson, he actually died of an anesthetic overdose. Anti-anxiety drugs. These include what are called benzodiazepines. Most common ones include Valium and Librium. Nowadays it included Xanax. These, by the way, should never be mixed with other sedatives like alcohol. Anticholinergics, anticonvulsants, which are commonly used with epilepsy and other seizure disorders. The most common one is Dilantin and some others that are also, by the way, used to treat bipolar disorder. Antidepressants, one of the most commonly prescribed drugs on the planet, including, we can talk more about those if you like later, but they include tricyclic and MAOIs, and of course the SSRIs like Prozac and Paxil. Antihistamines, which incidentally were the genesis of most antidepressant and antipsychotic drugs. Antihypertensive drugs, including things to lower blood pressure. Antimicrobials that are used to treat bacterial infections. Anti-Parkinson agents. Incidentally, there's a tremendous overlap in many of these groups. So, for example, anti-Parkinson agents include the most commonly used one for severe Parkinson's disease is L-DOPA. But other drugs are used, like ropinirole, which is what I take, that stimulate, or they're called dopamine agonists that mimic the effects of dopamine. And even back up to antidepressants, the group called monoamine oxidase inhibitors, which actually break down the uh, um, the pace of dopamine reabsorption. And of course, those are used early in this disease process. Incidentally, with Parkinson's, there's no really known reason why people get it. It's not genetic. People like Michael J. Fox have it. He had it from a very young age, at about 30. Muhammad Ali had it. His was more from being clocked in the head mostly. But there's some theories about it being caused by pesticides. I don't know. I don't have it. There's no family history of it. Antipsychotic drugs are used to treat psychosis, which include the first one was actually Thorazine back in the 1950s. If you watch the movie One Flew Over the Cuckoo's Nest, before they did the brain surgery on McMurphy, they tried antipsychotics, which are powerful drugs, most of which have severe side effects like extrapyramidal symptoms that is a hand wringing or tremor. Bronchodilators, which include drugs that are used to treat asthma. Chemotherapy to treat cancers. Corticosteroids are often used to treat inflammation. So a very common use of a combination of bronchodilators and corticosteroids are used to treat asthma. Like Advair, the purple disc has both of those in there. Of course, all of these drugs have side effects. Disulfiram, which is also called Antabuse, that's not the generic, that's a brand name of it, is used to treat alcoholism. Gastrointestinal agents used to treat upset stomach, like most of the over-the-counter aids to help with heartburn, and histamine agents, histamine agonists that prevent inflammation, immunosuppressants, like drugs to treat certain types of cancer. Insulin, of course, used to treat diabetes, to regulate the absorption of carbohydrates across the cell membrane. Interferon, which is also used to treat certain types of cancer. Lithium, which might be interesting to talk about later, especially if you're doing a paper on bipolar disorder. Lithium is a metal salt that's used to treat manic episodes. Funny thing is they don't really know how it works, but it's used. This can cause all kinds of side effects, though. There are muscle relaxants like Flexeril, that's used to treat muscle pain, especially if a person's tense. Often used after surgeries. NSAIDs, which are non-steroidal anti-inflammatory drugs, including aspirin and ibuprofen. It does not include Tylenol. That's in a class by itself. Oral contraceptives, of course, are used to prevent pregnancies. And, of course, thyroid replacement, which is used to treat either hypo or hyperthyroidism. And the reason it's mentioned here is because many problems that look like depression may actually be caused by a lack of thyroid hormone. So they treat it by including a regimen of thyroxine or some generic versions of Synthroid. So anyway, this is a good starting point. If you have questions and you want to talk about this during our Zoom meeting, feel free to bring them up, write them down, and bring them to Zoom.